Hi, my name's Sharon Kohler, and I'm here to provide a understanding and review of diabetes. Our learning objectives are at the end of this conference. You will know the difference between the three different types of diabetes, identify any myths associated with it, summarize current evidence-based guidelines so we can manage it successfully for students, and discuss the roles of teachers, parents, your school health personnel, caring for students with diabetes. So we're going to start at the beginning and review what diabetes is. So it is a chronic disease, meaning it will be here forever for the student, unless it's type 2 or gestational diabetes. But for most of the students you'll be dealing with, it will be type 1, which is a chronic disease. And that means that person's blood glucose or sugar levels are above what's normal or an acceptable range. So a normal blood sugar for a person is between 80 and 100. But people with diabetes cannot convert food to energy, so they may often feel weak and tired. People with diabetes, the pancreas will either produce little or no insulin, or the body's cells located in the muscles, liver, and fat will not use insulin correctly. So you're going to have a buildup of the glucose, the sugar in the body and the blood, and then the glucose is going to be eliminated from the body through the kidneys. So the body will lose its main source of fuel, and then you'll have excess glucose still remaining in the blood. Type 1 diabetes, also known as juvenile diabetes, is when the immune system destroys the beta cells, which are in the pancreas. So the pancreas will no longer produce insulin, and the students will need to take insulin subcutaneously daily to survive. So here's how type 1 diabetes works. So everybody has a pancreas that's located around your stomach area, and it has decreased insulin into the body in type 1. And then your increased glucose is going to raise because of the little or, well, actually no insulin. And then your muscles aren't able to use the glucose due to the low insulin. And then your body's going to produce glycogen and protein and break it down, causing what is called ketone acidosis. So that's making the diabetics' blood sugar more acidotic, so they're not maintaining their pH levels. And if that happens, you might notice like a fruity odor on their breath, and they're also going to have increased thirst. Type 2 diabetes, also known as adult onset diabetes, this is a progressive disease, meaning that it's going to get worse over time. It can be insulin resistance, where the body doesn't use their insulin properly. The pancreas doesn't produce enough insulin, and it's often found in overweight or obese population. You can use oral medications to treat type 2 diabetes, and then sometimes people also use insulin. So here's a snapshot of what type 2 diabetes looks like in your body. Again, you're starting at the pancreas, and there is sufficient insulin that's secreting into the bloodstream, but the glucose in the bloodstream isn't matching up with the insulin, so it's not doing its job. So the muscles aren't able to use the glucose due to the insulin resistance. And this is generally caused because of obesity. It can be genetic or an inherited factor, and it leads to, like I said, the insulin resistance. And then we have gestational diabetes, which we may see in our high schools occasionally with students. So this is when diabetes happens during the pregnancy. It can be caused by hormones. It's an insulin resistance or not enough insulin. It will usually, most of the time, go away as soon as the baby's born. The mother is at an increased risk of developing diabetes later in her life, and the baby is at an increased risk of obesity and type 2 diabetes. And often these babies are born very large, 9-10 pound babies. So this is just a picture of a GYN. So let's review some myths surrounding diabetes. So type 1 is also known as juvenile diabetes, only occurs in children. So this is false. This is not true at all. Type 1 can occur at any age, but it is more prominent in children. So then we have type 2 diabetes is adult onset and only occurs in adults. This is false. Unfortunately, in the United States, we have an epidemic, and that's occurring even with our children. And the children are becoming obese and sedentary, and because of their inactivity and eating more fast foods, that sort of thing, their bodies can't produce the insulin. It doesn't work enough to break down that glucose for energy. Other myths surrounding type 1 diabetics: cannot eat food with sugar. So this is false. That might be a surprise for everybody, but people with type 1 diabetes, they can eat what they want in moderation, but they need to give themselves insulin to cover the carbohydrates. It used to be back in the day that diabetes, they didn't know all they know today. So back then, if you were diagnosed with diabetes, they would put you on a non-concentrated sweet diet. And I think that's generally a lot of where people get those myths associated with this. People with diabetes should only eat diabetic foods. This again is false. Sometimes diabetic foods or diet foods, they use artificial sweeteners or sugar alcohol. These foods will actually can, not always, but can raise blood glucose. So complications, and this can be from any type of diabetes, but it can lead to blindness, kidney failure, non-traumatic lower limb amputations, heart disease, and stroke. Other complications. So a high blood sugar, another word is hyperglycemia. So this is high blood glucose levels, and over years it can also affect your blood vessels, your eyes, your kidneys, the nerves, and your teeth and your gums. So it's important too that diabetics go see their dentist regularly. All that extra sugar in their mouth can lead to a lot of breakdown and decay. Other complications, you have hypoglycemia or low blood glucose levels, and this can be caused by too much insulin, too much activity, not eating enough, or an illness. It can happen suddenly, and it requires immediate treatment. So if you have a student who's thinking they're low or you suspect they're low, we're going to want to check their blood sugar quickly. And if not treated quickly, it can lead to a loss of consciousness and seizures, and it can be life-threatening condition. It can impair cognitive abilities. So if you have a student and they're not acting like their normal self, or even you might think they appear drunk, that could be possibly a sign to you that they're having a hypoglycemic or a low blood sugar side effect. So here's a snapshot, and you all have this in your handout. Hypoglycemia symptoms. You have all these symptoms, and some of these symptoms are the same symptoms that you're going to be seeing for hypoglycemia, which is the low blood sugar. So, sorry, this is the hypoglycemia. So you can have these same symptoms for hyperglycemia. So you have shaking and sweating. When they're having a low blood sugar, they're going to feel really hungry, and they might feel pale. They might complain of a headache, blurry vision. They might feel really tired and sleepy. They might have dizziness, confusion, irritability. They might be argumentative or combative even. They can change their personality, be very weak and lethargic. They may not be able to eat or drink. And if you have that case, don't force them, because then they can asphyxiated, not swallowed correctly. So if they get to that point, you're going to need the nurse to inject glucagon. They can have a loss of consciousness and seizures. So hyperglycemia. So I put this picture here because pretty much they have way too much sugar building up in their body. And this is going to lead them to have an excessive thirst. And some diabetics, before they're diagnosed, have been known to be so thirsty that they'll drink water out of a toilet. It'll cause them to have a dry mouth and frequent urination. So because their body's trying to get rid of all the extra glucose, they're going to the bathroom a lot. It's being excreted through their kidneys. It's going to dehydrate them quick. It will change their appetite. They're not going to feel like eating too much. Blurry vision, fatigue, and then the impaired cognitive abilities. So they're not going to think quite right if they have a high blood sugar or a low blood sugar. So how we want to manage diabetes? We want to take care of it. And for our students, for their academic achievement and healthy well-being, students will have a Chapter 504 and or an IEP. Your certified school nurse will work with the students, the family, the faculty, and their physicians. Sometimes they'll probably go to a specialist endocrinologist for their care, and they'll develop an individual health plan for the students. They'll work with the school health team, and they'll make a plan for disasters and emergencies. So we're going to want to check the students' blood glucose levels. And this can vary. Some doctors will do it before meals, before after activities, prior to dismissal, and as needed. So students will have a blood glucose monitor, and nowadays you might have somewhere in a CGM, which is a continuous glucose monitor. And these CGMs are wonderful. They will let the student know. Some are set for every 3 minutes, some can do every 5 minutes, some even every 1 minute. And they will let you know on the student's phone most of the time that what the blood glucose is. And the parents can even have it set up to go off on their phone so they can keep an eye from home and alert you if, say, Susie May is having a low blood sugar and they may not realize it. So the mom will actually call into the nurse and say, hey, can you check on so-and-so? I think she might have a low blood sugar. So it's really a wonderful invention. So we need to make sure that the students are properly disposing of any sharps that they use and materials with blood on them. So we will have all disposal equipment kept in the nurse's office. We need to administer insulin according to their doctor's orders. So this can be from a syringe, via an insulin pen or insulin pump. And then we need to plan for special events. So if you have a field trip coming up or an extra activity after school, anything at all, and you have a student with diabetes, please notify your nurse so she can get you extra help or provide you with snacks or emergency first aid. So let her know ahead of time as soon as you know. So you want to promote regular physical activity for anybody really, but including those with diabetes. You want them to maintain a healthy weight. So you want to recognize and treat high and low blood sugars, and you want to promote their self-care and management. The students need to become their own advocates. So we need to be able to understand and care for their disease. So and we can start that at an early age, depending on when they're diagnosed. They can learn to do their own blood sugar test and put it in their machines or logs, however we're keeping records of that. And we need to deal with any emotional or social issues. Diabetes can affect every part of your life, complicating developmental achievements. So they might not want to be stigmatized and have others think they're special or different. So they can, especially in those teenage years, be a little more sensitive about their privacy, and we need to be um, provide them with that. Roles of the teachers. So you need to treat the student like you treat every other student. They need to feel included. We need to allow the student the freedom to drink some water or non-sweetened drink when they have a high blood glucose, and to have juice on hand if they're having a low blood glucose reaction. We need to allow for bathroom breaks as needed. Allow your student to visit the nurse as needed. If you think that your student's having a low blood sugar reaction, somebody that an adult or one of the paraprofessionals, somebody walk that student down to the nurse. If you don't think they can walk, if they're having a really bad, you think low blood sugar reaction, call the nurse, pick up your walkie-talkie, but don't leave the student unattended. Depending on the severity, the nurse may need to come to you. The role of your certified school nurse. She's going to be the go-to person for any support or education for you. She's going to be the one developing and working with the counselors and developing the 504, the IEP. The nurse is going to maintain supplies needed for each diabetic student that we have and extra equipment for use in her office. The nurse is going to keep track of the student's health records so that she can communicate with parents, the student, and her endocrinologist. The nurse is going to be the continuous communicator with the students, the parents, the faculty as needed, and any medical personnel. The role of the students and the parents. So they need to learn how to take proper care of themselves, the students. So we need to set student-specific training and goals for them to be self-management. So that is the goal, and the nurse will be working with them to get them there. We need to keep the students' supplies up to date. Parents will often send them home, and the nurse can communicate and send emails or phone call reminders. We need the students and the parents need open communication, and they need to provide the meals or snack planning, carb counting. If they're working with the dietitian in the cafeteria, the dietitian can help mom, dad, and the nurse with carb counts for portion sizes. So in conclusion, we all know that diabetes management in school is essential. Safety and long-term health of the student is our #1 priority. We want to maximize our students' abilities for learning, maximize students' ability to participate in school activities, and we want to minimize low blood sugars and high blood sugars emergencies. These students can have a healthy school. So let's take any questions. I have attached some forms for you you can keep on hand. I have a blood sugar level chart. So if you have a student who's testing their blood sugar level in your room, this will let you know if that blood sugar result is high or low, or if you think you need to call the nurse right away. It can help you with assessing that. So this screen shows you some low blood sugar symptoms in picture form. So it'd be an easy reference for you to quick look at. These are symptoms of diabetes. You might have a student who with no history of diabetes, but you notice they're going to the bathroom a lot, or they're drinking a lot. You might mention this to the nurse. They might be just starting to develop diabetes, and we might be able to catch it early and get them help sooner than waiting till their blood sugar is so high that they can slip into a diabetes ketone acidosis, which we talked about, will mess up their pH levels in their body. And here's that blood sugar level chart. So you might hear a blood sugar, like I said, called glucose, but that's really all it means. You can always reach me by phone, email, and I'll be glad to talk with anybody at any time if you have any questions. Thank you.